And before we start our next session, I want to name a content warning that this conversation will touch on themes of loss and death due to insulin rationing. As always, we encourage folks to do what's best to take care of themselves. This next session will be highlighting discussion among members of our Families United for Affordable Insulin, an advocacy and support group for those who have lost loved ones to insulin rationing. They'll be exploring how to take back your power with advocacy after experiencing loss. And this session will include a discussion with Families United for Affordable Insulin group members on empowering ourselves through advocacy after loss and from a mental health lens. And I want to first introduce you to Dr. Harpreet Nagra, one of T1 International's board members and a certified diabetes psychologist. She'll be facilitating the discussion today. Thank you so much for joining us, Harpreet. Please take it away.
Thank you so much, Faith. I want to start off by saying thank you all for joining us for today's conversation. As Faith mentioned, my name is Dr. Harpreet Nagra. I'm a licensed psychologist, and I specialize in diabetes psychology. So I hear the full breadth and range of everything from the initial shock that comes with the diagnosis to the day-to-day hassles that occur to some really challenging grief-related and loss-related. But my goal and purpose in being here today is to speak as little as possible and create a brave and a safe space for the two courageous individuals who are here to share their stories. So today we'll hear the journeys of two incredible T1 International supportees and two incredible human beings who experience both the heartache of insulin rationing as well as the empowering journey to diabetes advocacy. These two individuals are Mindi and Nicole, strong supporters of T1 International for years. We think it's important to have this conversation with everybody here because such stories are rarely shared out in the media. That in and of itself can create feelings of loneliness, isolation for those who may be at various steps of the journey. Before we get started, we do have an audience poll to capture the prevalence of this problem. So this is an anonymous question that we're asking, and please feel free to be as honest as possible. We're trying is how often we're seeing this issue come up in everybody's life. So the question is, have you rationed your insulin or know someone who has? So please take a few minutes, few seconds to respond. And our team will have the poll coming up right now. And please take a few seconds to respond. Again, the results are completely anonymous. We're not sharing names. The purpose is just to share how often we're seeing this problem occur. Okay, for the interest of time, I think we can take the results of the questionnaire. About 12% of you participated in the poll, and 100% of you indicated that yes, you have rationed your insulin or know someone who has. We'll go ahead and share the results. And with that, without further ado, let's get started. I think it's important to hear the stories that are indicated here. So Mindi, I would love for you to get us started with a brief introduction of what's brought you here.
Okay, I'm Mindi Patterson. I'm going to tell you a brief, abridged version of my journey to T1 International. It starts in the year 2000 when my oldest son was born, and my sister-in-law, 3 weeks after my son was born, ended up being diagnosed with diabetes. Fast forward to 2013. During that 13-year journey, I knew she had a pump. I knew that she used insulin. I knew very little. She didn't talk about it a lot. She's a nurse. She had been a phlebotomist for a while. She had gotten her LPN and was working on her RN. In 2013, at the end of the year, my youngest son was 8 years old. We had just celebrated Christmas. And a couple days afterwards, he ended up being sick. So we took him to the pediatrician. I was at work. Pediatrician thought it was a strep diagnosis, sent him home with amoxicillin. We started that. He started vomiting that night. By the morning, I was worried about dehydration. I took him to the hospital. They said it wasn't strep. They thought a stomach bug, gave him Zofran and sent him home. He progressively got worse during the day. By the end of the night, I thought he had fallen asleep. We'd been up for 24 hours and he had not fallen asleep, but we woke up to breathing that sounded like he'd been running a marathon. We ended up back at the hospital. I drove him. My husband had called the ER and they said, wait 10 minutes. And I thought, I'm not waiting 10 minutes. He doesn't look good. His skin is cold. His lips are ashen. He wasn't responding to me. And I literally carried him in. They took him to the trauma room immediately, and we almost lost him. He was diagnosed within 15 minutes with type 1 diabetes and was in severe DKA. We managed to get through that, got home. We were doing pretty good. At the end of 2014, my oldest son showed symptoms of diabetes, and we had him tested by Martin's, my youngest son, by his endo. Showed up that there were no antibodies, autoantibodies, so we weren't terribly worried, but as a mom, I was on high alert. When Martin was diagnosed, his blood sugar was 800. He had an A1C of 13.7. I didn't ever want to go through diabetic ketoacidosis again. It was not good. In 2015, at the end of February, Pierce started showing more symptoms. In March, he woke up with a symptom that doesn't happen to a teenage boy, which I won't share because he would be mad with me. But I ended up taking him in. Again, I couldn't take him to the endo, but I took him to our family doctor, and the family doctor diagnosed him with type 1 diabetes. His A1C was 7.7. His highest blood sugar that day was 350. And I was able to start insulin right away because we had it in the fridge. And I was able to talk to the endo on the phone, and we didn't even have to do an overnight at the hospital at all. And we did a refresher course the next morning. We managed pretty well. Between 2015 and 2018, Megan had 2 bouts of diabetic ketoacidosis, but both of those times they didn't look anything like Martin's. She was talking and joking. Yes, she was in the ICU, but she seemed okay. We had more conversations about type 1, so I learned a little bit more, but she was still pretty private on a lot of things. In 2018, my husband in 2011 had been diagnosed as type 2, but in 2018, we weren't able to really take care of his diabetes. It was seeming to just skyrocket. He had done Januvia and metformin, all the different medications, but his A1C kept going up, and he couldn't get his blood sugar under control, to the point where the boys were like, maybe you need to take our insulin, which is kind of a scary position. So I kept telling him he probably had type 1 because he has a lot of autoimmune issues going on, but it took him almost going into DKA because he was definitely having issues, that he finally went and got tested, and turns out he is what's called LADA, latent autoimmune diabetes of adults. So essentially a combination of type 2, type 1, but it is autoimmune, and he had to be put on insulin as well. While we were working with that, he is a disabled, he has mobility issues. So trying to give shots, trying to learn how to use a pump, it took a lot of our focus. In June, we hear from Megan that she has lost her job as an LPN and lost her insurance, and doesn't know what she's going to do because she only has about a half a vial of insulin left. And I told her to come on over because at that point I had already gotten involved with parent groups, and I managed to find some people that could donate to her. She managed to procure insulin from June until December, but she did not land a job that was full-time that got her insurance. So she was definitely rationing throughout that point. She never said she was rationing, but I know now, having worked with my children, how easily that comes up. In December, Christmas happened. We didn't hear from her. The next morning, we got a phone call from her roommate. Her roommate had gone to work the night before. Megan wasn't feeling well. She had been throwing up all night Christmas Eve, and her roommate went to work, thought Megan was asleep on the couch. And when she came home in the evening, she thought she was still asleep on the couch. When she got up the next morning after Christmas, she realized that Megan had passed away. And going through her house, we found a partial vial of the Walmart insulin, Novolin and pH, and an empty vial of Humalog, an empty vial of Novolog, and maybe 10 test strips. Looking at her meter, which I knew how to check, she had maybe been testing once every couple days. So there was no accurate indicator for her to know even what she should be doing. That brought me to T1 International in a heartbeat. Previous to that, I had signed a Mother's Day card that Nicole had been part of. And so I had already heard about the movement, but I never thought it could happen to us. And I think a lot of people go through that. It just can't happen to us. So we're not in that same position.
Thank you so much for sharing, Mindi. I know it's so hard to relive the milestones of everything that led up to that moment. And we're so grateful that you were share your story.
Thank you.
You have been. And we're so grateful to have you be a part of T1 International, because I don't think we could do the work that we're doing without your support and your commitment to the work. Thank you. Nicole, would you like to go next?
Sure. After I wipe my tears away, because it's so heartbreaking to hear about, the loss that Mindi has experienced. So my experience, Alec was diagnosed just as he was turning 24. He had what we thought was the flu. It was flu season. He wasn't feeling well. For days on end, he wasn't feeling well. And symptoms started progressing. And I remember sitting at work one day, and he called me bright and early in the morning and said, I feel like I'm dying. And I'm like, Alec, what is going on? Thinking, typical man flu, not feeling well, it's the end of the world. But the things that he was describing and the way that he was speaking, I knew that something was seriously wrong. I heard the shortness of breath. I heard him tell me that he was unable to control his bladder, that he was experiencing the most intense muscle cramps that he's ever experienced in his life. Difficulty walking because he was dehydrated and his muscles were cramping so bad. He was scared, which, made me scared. He wanted to see the doctor. At turning 24, I said, call the doctor, see if you can get in. When he called me back and said that they didn't have an open appointment for several days, and that he knew that he couldn't wait several more days to see a doctor, I suggested that he go to urgent care. I suggested that he call somebody to take him to urgent care, but him being a 24-year-old independent young man, he drove himself. The next phone call that I got was that he was in urgent care and that they have diagnosed him with type 1 diabetes. And I said to him, you know what? I think you should leave that clinic because they don't know what they're talking about. Type 1 is for kids, and you're not a kid anymore. He's like, no, Mom, they've got me hooked up to insulin. They said that my blood sugars were off the meters. And they've got me connected to IVs for fluids. And immediately I went on to the good old trusty Google to make sure that they weren't giving my son insulin when he didn't need it, because obviously these people didn't know what they're talking about. And to my surprise, at that time, I learned that type 1 diabetes can be diagnosed at any point in your life. I had no clue. So yeah, he walked out of that urgent care with a few handouts and the best wishes to keep himself alive until he can get into an endocrinologist. He went to the pharmacy that after leaving, he drove himself home. They got his numbers down to about 300 and took himself to the pharmacy. And he called me from the pharmacy and was like, Mom, like, pardon my language, he's like, this shit is expensive. He's like, I just paid over $300 at the pharmacy. Is this what I'm going to have to do every month? And I was like, no, I bet you it's because you haven't met your deductible. The family hasn't met their deductible. It can't be this expensive. I'm like, I'll give you some money when I get home. And that's how things went. Month after month, it was not as expensive. It was, $200 here, $300 there, depending upon where we were, throughout the year and whether or not the deductible was met. We'll fast forward to, Alec 25, and he had made management at his job, and he was promoted, and he was making a salary of about $40,000 a year, and he wanted to move out, get his own place. He's 25, he should be able to do that. I was concerned because he was going to be living alone for the first time ever, and he's got this chronic illness of type 1, and who's going to make sure that he takes his insulin and his numbers are good and he's safe. But he assured me he had it all under control. So he moved out about 6 months before he turned 26, and things were going well. I didn't hear of any issues or problems, and we had been actively working on trying to figure out, what he was going to do when he turned 26 and aged off of my insurance. So I was on, the website for the marketplace and creating dummy people to, get an idea of cost and eligibility. And I was finding that it was going to be, a good $450 a month for him to purchase a plan through the marketplace, and really, really high deductibles. And, I had to sit my, 25-year-old down and explain what a deductible was and what a copay was. And he looked at me and he was like, this is just stupid. Why would I pay $450 a month for insurance that isn't even going to kick in and help me with my bills, my copays and all that until I've met, the $7,600 deductible. He's like, so I'm going to keep this $450 a month and just pay for my insurance out of pocket at the pharmacy.
Yeah.
So on June or May of the following year, which would have been May of 2017, Alec turned 26. And on June 1st of 2017, he officially was uninsured. Around the 22nd of June, he went to the pharmacy the first time to buy his insulin and was asked to pay $1,300. Payday was next week, and so he didn't have $1,300. And my son went home and proceeded to ration his insulin. And unfortunately, a few days after that, Alec's body was found. He died from diabetic ketoacidosis from rationing his insulin. Unfortunately, he didn't ask for help. We didn't know about, support groups. We didn't know about the diabetic online community. We didn't know anybody who had spare insulin. We didn't know that you could share insulin. We didn't know about the black market or the gray market. We just didn't know. So Alec died. And because of his death, I have, taken my outrage and my grief and my disappointment in our government and our elected officials, and I have used that to advocate for access to affordable insulin. And I'm going to continue to advocate until we get to where we need to be.
Absolutely. Thank you so much, Nicole. I think you and Mindi are both superb examples of mothers who did everything possible. You sat down with the conversations, you wanted to make sure that they were taken care of in every aspect. You asked the right questions that needed to be asked, but there's some times where it's hard to know what's going to happen next. So I'm so glad that you both felt comfortable today sharing your stories. And I hope that anybody who's listening to this summit, this particular session, knows that you're not alone. Some of the experiences that our advocates have had, especially, the experiences that Mindi and Nicole shared today, these are not isolated incidents. They happen all across the world on a regular basis. Unfortunately, that's the truth. But we hope that in hearing these stories and in sharing the sort of experience that seems so unique when we're living it, but it's such a universal experience that it allows you to ask questions, talk to others, reach out for support, reach out to T1 International in particular, whenever possible. Get this the community that you need, get the community to be available to you that you need. And some of it is absolutely not within our control. And I think system-wide, there's tons of changes that need to be made, as we are all here talking about it today. So I will leave it at that. Thank you so much, Mindi. Thank you so much, Nicole, for being vulnerable and safe and brave with all of us today. I know that we're in a virtual setting, so you probably can't feel all the love, but I hope you see all the hearts and blue hearts and the red hearts coming your way, to know that we're all behind you as you all continue on your journey as advocates. And with that, I will pass it back to Faith for our next session. Thank you all.
Thank you so much, Harpreet and Nicole and Mindi. This was a really authentic and important session. And like I said in the chat, it's really hard to hear, but I can only begin to imagine how hard it is to be directly experiencing the effects of insulin rationing. We really appreciate your willingness, not only today, but for years, to share your stories with folks in the hope that it would drive change and make the lives of others with type 1 diabetes safer and happier through the access to this basic life-saving medication that everyone should have without stress or hardship. If this session resonated with you, we hope you'll join Dr. Nagra and T1 International on Friday, November the 3rd, for a skills building session around processing grief. At T1 International, we know that advocacy can be exhausting, and that the same can be said about having a chronic illness. And there are many ways in which those in this fight have experienced loss of loved ones, as Nicole and Mindi have bravely shared today, as well as loss of opportunities, financial security, the idea of the life you thought you'd live before your diagnosis. We recognize that advocates fighting for insulin for all are often living at the intersection of these things. And as part of our commitment to holistically developing leaders, prioritize creating space for skills building around mental health practices. Anyone is welcome to join us for our 2-hour workshop on sharing and processing grief. We'll send out more details, and registration will be sent out in October. How is everyone doing though? Discussions on loss are really important, but they can also be really tough. So we hope you're holding up okay. Please spread a little bit of extra love in the chat, as you have been doing, for those of us that need it.